As the food industry, from farm to fork, grapples with the COVID-19 pandemic, I hope you will tune into Grocery COVID-19 on Tuesdays and Thursdays at 12:30 p.m. on Winsight Grocery Business and Supermarket Guru Facebook pages. On these Lempert Report videos, we will address COVID-19 stories as well as continuing our focus on marketing analysis, issues, and trends for the food industry. Wash your hands, practice safe distancing, and get in shape. What hasn't been talked about that much is how our body's weight and overall health impacts those who have become infected with COVID-19. Researchers at New York University identified obesity as the biggest risk factor for people admitted to hospitals with COVID-19, along with age, being over 65 in their study. Factors associated with hospitalization and critical illness among over 4,100 patients with COVID-19 disease in New York City. Per capita death rates from COVID-19 in New Orleans, whose population suffers from high levels of obesity and related ailments, including diabetes, have been reported at twice the rate of New York City. What makes these facts alarming is that the U.S. leads the world in the cases of coronavirus. On top of that, the U.S. ranks first among OECD, Organization for Economic Cooperation and Development nations, and has an adult obesity of 42.4%, according to the Centers for Disease Control. And now that everyone is homebound, or should be, our eating habits have changed. We're now cooking more at home, oftentimes eating more meals and snacks than we're accustomed to. And frankly, we've been forced to buy what's on the shelves in our supermarkets, not necessarily the foods that were normally on our shopping list. According to IFIC's 2019 Food and Health Survey, 75% of consumer diets have trended healthier over the past 10 years, with lower sugar intake and eating more fruits and vegetables as the biggest changes. But I hesitate to say this, in these times, all that will change, and for the worst, I'm afraid. Supermarkets have a responsibility to their shoppers. And when this pandemic is all over and our grocery stores do return to normal, it will be important for those stores with retail dietitians to take the lead and help customers return to healthier eating. And for those stores without a retail dietitian, it may be time to hire one.